Hi there, my name's Aamena Salar. I'm a GP specialising in gynaecology, and I've been involved with a research implementation study looking at early diagnostics in primary care for ovarian cancer. It's a real privilege to be here today at Ovacome's West Midlands members meeting. And really what I wanted to focus on today is what we don't talk about, which is after your diagnosis, how do you get the most out of your primary care team? So seeing you through your whole journey. First thing to say is don't underplay what you can get out of your primary care team. And, we'll talk about a little bit later on the issues of access to getting GP appointments, which I know is a real problem. But there's a lot that your GP can do after the diagnosis. They're there to support you through the whole of your journey, to provide continuity, to advocate for you. They're the gatekeeper to your specialists and other services. Psychological support, support for your family, and also there's a lot of administrative stuff that you might need help with. For example, claiming benefits, being referred to a social prescriber for support on things like housing, etc. So there's a lot that your GP can do. So, as you know, primary care team doesn't just involve your GPs. There are your nurses, pharmacists, social prescribers. In some practices, they even have like well-being coaches, all of which can provide a lot of support for you and your family. I think one of the big tips I would say is that I know how hard it is getting a GP appointment. It's actually probably easier getting appointments with those other guys. So if you're having issues accessing your GP, then maybe book an appointment with your nurse or your social prescriber. And again, they can help move your care along. So there's a whole sort of multidisciplinary team approach to your care, both in primary care and in secondary care. So in primary care, you'll be seeing hopefully your GP, nurses, you could even see your social prescribers, your well-being coaches, and community or district nurses. In secondary care, you'll be aware that it's not just your doctors, you'll have CNS or specialist nurses and pharmacists that have got the expertise, particularly in your cancer care and medication. But also there are psychological support and well-being teams that might be available to you through your primary care or secondary care teams. And they're sort of an independent provider of therapy, if you like. But the other things to be aware of is your access to urgent care through 111 or through A&E in the event that you have an acute problem. The one thing that I would say as a tip is it's a lot to be going through, and that's a very obvious thing to say, but once you've been diagnosed with ovarian cancer, it's overwhelming. And the number of people involved with your care can get overwhelming too. So just a really simple practical tip, just keep a note of who's looking after you. So you will have a named consultant, for example, and have their contact details, not just their name, but their secretary's name and their phone number. And the same with your CNS nurse, your nursing team. It just helps you have it all in one place so you can reach to it in the event that you need them. So I'm fully aware that, a diagnosis of ovarian cancer is a serious and significant one. But what I would ask is try to come prepared for your appointment, okay? If you can write down 2 or 3 of your main concerns in advance, maybe keep a symptom diary if that helps you, or maybe bring somebody in so that they can help fill in the gaps if you forget, then it means that you can be direct and clear. And I think because you've got a limited time, it's 10 minutes for a telephone appointment, for example, with a GP, try and be clear about what your concern is. Be direct. Don't be worried about saying, I'm worried about this, I'm worried about my ovarian cancer. The other thing is to try and understand what the next steps are. And again, don't be scared about prompting your GP. So, questions like what's going to happen next, when should I come back, what are we doing afterwards in terms of follow-up, are all absolutely appropriate. The other practical tip that I would say is that if you're not happy with how that consultation's gone, if you feel that you're not being heard or your needs are not being met, you're perfectly entitled for a second opinion. And there's lots of ways in which you can do that. Go back to your GP and go, I want to see somebody else, or that same GP and say, I didn't feel that you listened to me. And it does happen. I've had it myself. And then the other thing is, if you're still not getting the support and care you need, then there are PALs, there's Ovacome to support, to be able to help navigate and advocate for yourself. There's loads of things that your GP can do for psychological support following a diagnosis of ovarian cancer. The one thing to say is that it's a huge diagnosis with a big psychological impact, so please don't downplay it. You'll need a lot of support through your journey. As a GP, we've got access to a lot of services, whether that be online therapies, for example, or we can actually refer you for psychological support, whether that be a counsellor or a therapist. We can also prescribe medication if you're feeling anxious or needing help with sleep. We also have access to social prescribers within primary care, and they've got an even bigger network of people that they can help you with support through, again, therapy, maybe applications for benefits, for financial support. So it's worth tapping into those guys too. I can't emphasize enough how big a diagnosis this is and how much psychological impact it has on a person. And struggling on your own is something that I would say, please don't do. Reach out, get some help, get some support, including Ovacome. There's plenty of support that everybody can provide. I think the one thing that I would say is that ovarian cancer treatment obviously is led by your secondary care team, your oncologists and the pharmacists. As a GP, I don't hold the expertise and understanding fully of ovarian cancer and the medication, but what I can do is to talk through, hopefully in plain language, what's been going on. By that I mean that there's a lot of medical jargon, there'll be a lot of terms that are thrown at you, letters that are sent to you that we can try and unpick and explain with you, hopefully provide that safe space and continuity throughout your journey. We can also help with things like medication, so if there's any questions that you're struggling with your medication, maybe side effects that you're having, then we can liaise with your oncology team and see whether we can help with that. So you're completely entitled to get your medical records. You can do that in many ways. First of all, you've got access to your NHS app, which will have some information about some of your consultations and your test results. You can go to your GP directly and ask for a full copy of your medical records. And when it comes to hospital records, again, there's something called a subject access request, which you can put through either through your CNS or your oncology team directly to ask for your medical records. If you are seeing somebody privately, it'd be a good idea to take a complete set of records rather than just say results, so that they can get full information and they've got everything there that they need to guide you.